St. Petersburg plastic surgeon is scheduled to stand trial next month for possession of crystal meth. But the I-Team has learned that it's the second time he's faced that same charge in less than a 3-year period.
Hello, sir. Can you step out of the car for me?
Sure, I'm sorry. What did I do?
It's okay. I'll tell you in just a minute, all right?
That's St. Petersburg plastic surgeon Dr. William Wright Adams, arrested by St. Pete police while driving to work on May 24th, 2022.
I'm supposed to be operating.
Okay, that's fine. This is more important right now. Operating where at?
I'm a plastic surgeon.
Okay, where at?
My office?
Where's that at?
On 9th Avenue North.
Okay.
During the stop, officers search his SUV as a patient waits at his office for plastic surgery.
They're putting somebody to sleep right now for me to operate on.
Okay.
So I have to call
Would you
them.
like me to
I
call
can't
them
be
and
there.
tell them? Or are they going to do that when you show up?
They're all waiting for me right now.
After following Adams from his home, police stop him for questioning in connection with a 2021 burglary. According to a police report, the co-defendant told police Adams hired him to burglarize an ex-boyfriend's home. The report says a security camera captured Adams' vehicle and neighbors spotted a man wearing teal scrubs near the victim's house. During the stop, police found a glass pipe inside a leather backpack.
Do you have a meth test kit?
They also found a packet the police report says contained 3 grams of crystal meth.
You have the right to remain silent. Anything you say can or will be used against you in a court of law.
All rise. Circuit Court in Fort Pinellas County is now in session.
Adams was charged with possession of methamphetamine and residential burglary. He pleaded not guilty, but 17 months later, Adams has not stood trial on the charges. A trial is set for December.
You're pretty close to having the case worked out?
Yes, sir.
Okay, that's fine.
We observed patients and staff at Dr. Adams' office.
I appreciate it.
And when we recently called and asked to speak with him, we were told he was busy with patients. The Department of Health's license verification website shows Adams' license is clear and active, with no record of complaints or discipline. The 2022 case wasn't Adams' first methamphetamine arrest. A 2020 police report says sheriff's deputies seized this packet of crystal meth from Adams' backpack while he was going through security at the Pinellas County Justice Center. Adams pleaded not guilty to that possession charge in June 2020, and the prosecutor dropped the case that October. Adams was attending a hearing after his ex-boyfriend sought a restraining order, claiming in this document that Adams sent him a message saying, "If you value your life, I wouldn't do that," in response to a threat to report him to the medical board because he smokes meth. Adams' ex dropped the case.
And they were yelling all night long, breaking stuff.
That's Frankie Stiles, who said she and Adams had been friends for years. When she had nowhere to live, Stiles said Adams allowed her to stay in a camper in the driveway of his $1 million home in St. Pete Beach. But that friendship didn't last.
The police are coming around quite often.
Yeah, when the police all know him, and it's just like another random stop to them.
We obtained this report of incidents at Dr. Adams' home from the Pinellas County 911 Center, and it shows that during a 2-year period, medical personnel and sheriff's deputies responded here more than 40 times. One call involved deputies serving a narcotics arrest warrant on Adams' then house guest, who a report says had crystal meth in his pocket at the time. On May 14, 2021, Adams' house guest went missing after threatening to stab himself. 3 months later, a report says that the two got into a verbal argument that escalated to the point that Adams' house guest grabbed an electric chainsaw.
Though you reached out to the Florida Board of Medicine?
I did, and so did a few other people.
Stiles started a Facebook page with videos from Adams' home and arrest records. She says she gave those things to the medical board and talked to an investigator.
Did the investigator know he had been arrested twice?
Oh, yeah. I sent him everything that I had.
We called the medical board investigator, who confirmed that he had spoken to her and that there was an investigation, but he wouldn't comment further and referred us to a spokesperson. We contacted the Board of Medicine spokesperson multiple times and emailed Dr. Adams' arrest records, but we didn't receive any response. Dr. Adams, through his attorney Kevin Hayslett, declined an interview and did not comment. After we inquired about the cases, Adams posted on Instagram that he plans to retire from his practice effective December 1st.
It's been physically, emotionally, and financially daunting.
Tiffany Soriano says her life's still not back to normal after undergoing a tummy tuck and liposuction from Dr. William Wright Adams. Her first surgery was in February 2021, following the birth of 3 children by C-section.
That's why I kind of took that huge leap, was to feel better about myself, to finally feel confident.
Did you have any idea that this doctor had already been charged with possession of methamphetamine before he did your surgery?
Absolutely not, because I would not have gone to see a surgeon had I known that. You know, that's the last thing I would have thought.
Still free and clear license.
Yes.
How do you feel about that?
It just scares me a little bit.
Tiffany says she learned about Dr. Adams from listening to Wild 94.1 FM.
There were ads for giveaways that they were doing for like breast augmentations and things like that.
Adams gave away procedures as recently as last year, according to these contest rules. Women were selected for surgery after submitting photos and essays to Curvy Claws and Glow Up contests promoted on the radio and social media. Tiffany says she was uneasy about Dr. Adams on the day he first operated.
He came in and he started to draw on me, and I noticed that he smelled very much like cigarettes. It was a very, very strong smell.
She says that surgery resulted in complications, additional surgeries, and painful recoveries.
That was my belly button uneven, my scar up very high. As soon as I opened the binder, I said, my belly button's off center. And as I healed more and the swelling went down, I noticed a lot of unevenness where the liposuction was done.
Months after her initial recovery, she returned for a second procedure.
They did more liposuction and they did move the scar. They had to completely open me up all over again.
That time, her incision was closed with 64 staples instead of sutures. Tiffany said Dr. Adams asked her if her wound had opened up after surgery.
No, that's not me.
So you feel like he got you confused with another patient?
100%, and that happened more than once.
Tiffany found in her medical records 2 progress reports from Dr. Adams that offer very different descriptions from what she says was a single appointment.
On June 30th, there are 2 different papers.
One says the patient is without complaints and has greatly improved. The other says she had a palpable weakness and referred her to another doctor for a possible repair if this is a hernia. Tiffany has undergone 2 subsequent procedures with another surgeon and plans to have a 3rd hernia surgery. St. Petersburg plastic surgeon Dr. William Wright Adams pleaded guilty to felony charges of burglary and possession of methamphetamine.
Do you understand the charges you're pleading guilty to?
Yes.
17 months after his arrest and a week before his scheduled trial, Dr. William Wright Adams pleaded guilty to felony burglary and possession of methamphetamine charges. In court, prosecutors described how Adams hired a man to steal jewelry and other items from his ex-boyfriend.
Co-defendant stated that the defendant, Dr. William Adams, paid him $1,000 and gave him a bag of crystal meth to break into his ex-boyfriend's home and steal items, including an emerald belly button ring.
Adams paid $50,000 in restitution to his victim and agreed to serve 90 days at the Footprints at the Beach Recovery Center instead of spending time in the county jail, a significant departure from a nearly 2-year recommended minimum sentence.
I think the state attorney's office saw the need for a first-time offender who's never been arrested or never been convicted for anything in his life. So this is the first time that he would have any criminal charge that would result in a conviction.
When he completes residential treatment, Adams will also face 3 years of drug probation, making him subject to random drug testing. And during his probation, Adams has agreed not to practice medicine.
2 arrests in basically 3.5 years. He's never been suspended, he's been practicing medicine this whole time.
Yeah, those are good questions for the board, and I think the board has got issues in how they handle. I know they got tons of cases to take care of. This case never went to hearing, so in this case, he practiced the entire time.
During our reporting, patients reached out to us alleging they suffered complications and injuries from Dr. Adams' procedures. And they're telling the I-Team they believe the Florida Board of Medicine, which is supposed to ensure the fitness and competence of doctors, let them down. These are former patients of St. Petersburg plastic surgeon Dr. William Wright Adams. 3 say they had complications from plastic surgery Dr. Adams performed after he was arrested for possession of methamphetamine. And one, Frankie Stiles, says she reported suspected drug use and his possession arrest to the Board of Medicine after he was arrested for possession of methamphetamine.
I got married April 1st, April 27th I had the surgery, and my life changed.
Diane D'Angelo says after Dr. Adams performed surgery on her breast deflated. She got an infection and her wound reopened nearly 2 months later.
I look at my wedding pictures and I look really nice, and now if I even thought to put on that dress, I couldn't even wear it. I mean, my whole body changed.
Patty Monofusco had to go to a wound specialist after an infection following breast implant surgery. According to her medical record, she also had to undergo an additional surgery because her left breast was much higher than her right breast after Dr. Adams replaced her implants.
He put my implant under the muscle instead of over.
Rachel Hoffman says she underwent multiple surgeries and suffered infections.
3 years of pain and hell, basically.
The photos of her blackened flesh are so graphic we chose not to show them.
If you look at us, you can't tell, you know, but we look at ourselves daily and see the scars.
Those patients believe the state should have taken action after Adams' 2020 arrest.
They failed us. They failed all of us.
Under Florida law, Adams was not required to report his drug arrest to the Florida Department of Health or the Board of Medicine, which regulate his license. But we've learned others reported his arrest and suspicions of drug use to the state. A Department of Health investigator was assigned to investigate, but Dr. Adams never had a disciplinary hearing.
We never got to that point. Had a hearing take place, I don't know what would have happened.
And we've been contacted by people who had surgeries after some of these arrests, and they claim complications. Is the state of Florida not looking after these patients?
That's a good question for the medical board.
When we didn't get responses to our emails to the board, we traveled to Orlando where they were meeting to talk with the chairman, Dr. Scott Ackerman.
Every complaint is taken seriously. And there's a whole stack of complaints, and we have a very large staff that looks at that. And when they find that there's real cause, then that's acted on.
How long does it usually take by the time they're sitting in this room?
If it's something really egregious, there's usually an emergency restrictive order that comes from the Surgeon General.
We showed Dr. Adams' former patients our interview with Ackerman.
I wonder what an egregious mishap is.
Should he have had to report that he was arrested for methamphetamine?
You know, this is America, and you're innocent until proven guilty.
They should have drug tested him.
Exactly.
At least.
Had some follow-up.
Yeah.
Should have been priority.
Yeah.
In Florida, if a commercial truck driver is suspected of drug use and refuses to take a drug test, his license is suspended for a year. Professional pilots are regularly tested for drugs, and positive tests are reported to the FAA, which suspends their medical certification. But a surgeon arrested for drug possession in Florida doesn't have to put down his scalpel.
I'm not sure if they can ask him to submit to a drug test.
Because that seems to be where the problem is if he possesses it, you can't show he's using it or he's abusing it up until that point where he goes to enter rehab.
It's also the obligation of the police.
In what particular facility, man?
But medical malpractice attorney Jack Gordon says it's easier for the Florida Board of Medicine to take action than it is for prosecutors.
The state must prove the case beyond a reasonable doubt. The Department of Health must prove by a preponderance of the evidence.
Gordon says state law allows the board to compel a doctor to submit to a mental or physical exam, but the doctor can fight that request in court. This Department of Health diagram shows how complaints about doctors are investigated and resolved. The enforcement process takes 11 steps from complaint until the case makes it to a full hearing of the Florida Board of Medicine to impose a final discipline order.
You're always going to have a few bad actors that fall through the cracks, but we really have a Swiss cheese model here, meaning that the holes are in different areas and mostly everybody gets caught.
Does that make you have more trust in the Department of Health?
No. None.
And I want to reassure Floridians that the health care being provided by physicians in Florida is top-notch and it's being monitored appropriately.
This case never went to hearing, so in this case, he practiced the entire time.
3 weeks after Dr. Adams pleaded guilty to felony drug possession and checked himself into rehab, the Department of Health website shows his license is clear and active with no history of discipline or complaints.
By entering this plea, you're giving up all the rights outlined in this document.
Yes, sir.
I'm I-Team investigator Adam Walser with photojournalist Matt McGlashan, taking action for you.